Okay, I am live. Since I'm live, I guess I'll start flapping my gums. As you know, Prime Minister Boris Johnson of the UK got in contact with the COVID-19 virus, and he recovered. And this was brought to my attention tonight, just doing my research for this channel. And I just check out the link below. Check out the link below, and you'll see what I'm talking about. But Boris Johnson, the Prime Minister of Great Britain, who is not a left winger, he's not a radical trade unionist, he's not a communist, he's not a socialist, he's not even a social democrat. I mean, he said that the NHS saved his life. Now, I don't. I mean, I watch enough Fox News and listen to enough conservative talk radio that this should have been this should have actually caught my attention, but it didn't. I mean, they said he did fine, but they I didn't hear them say with the quote NHS saved my life. He even also said that the NHS is the beating heart of our nation. Oh, you didn't hear Fox News, you didn't hear Sean Hannity, or you didn't hear on Fox and Friends. You didn't even hear it on the Silly View, which is the liberal version of Fox and Friends. Both absolutely just insufferable. You didn't hear it on Rush Limbaugh. You didn't hear it on Glenn Beck. You didn't hear it on Mark Levin. Little Ben Shapiro, I'm sure, didn't mention it because it would go against their narrative. We get in the right wing media, social media, and the actual media. You can't. That is a rule. Can't say that the NHS did anything good. When you talk about the NHS, you're supposed to tell people how terrible it is and how dirty the hospitals are and how much long waiting lines there is and people are dying all over the place and all the disasters you hear about. Then there's this gruddy little thing called the truth that kind of leaked out by Boris Johnson. Don't get me wrong. I mean, obviously, as a Bernie Sanders supporter, if I lived in the UK, I would be a member of the British Labour Party, and I would have voted for my Labour MP or for an MP in my constituency. That's like a congressional district in the UK. I would have voted in my constituency for probably whoever is the Labour candidate running. And I would have still rather have seen Boris Johnson living on 10 Downing Street than Jeremy Corbyn living down on 10 Downing Street than Boris Johnson. But I'm glad that Boris Johnson is well. I mean, I don't want anybody to suffer, not at all. I mean, the only people I want to see suffering, and I don't mean physically, but the only people I like to see suffering would be private health insurance companies and executives and people connected to big pharma that I think they should serve some jail time for the misery and deaths they have caused to the American people with this asinine healthcare system, this nightmare that we call healthcare in the United States. And this puts to rest this ugly smear, this ugly lie by the right wing in this country that if we were to copy or enact universal health care, that we would somehow turn into some third world dictatorship, that will somehow turn into the Soviet Union the way it used to be, or turn into North Korea or China or Cuba or Venezuela or what have you. Healthcare to everybody in a nation is what a healthy, normal, Western capitalist democracy do for their people. It is so normal and so I mean, to the point where it's taken for granted. The sexy headline in the right wing press in the United States is somebody dies because they were waiting in line, or they botched up a health surgical procedure because they're just obviously not capable of running. Becoming doctors can't obviously do their work in those countries. I mean, you hear stuff like this all the time. Now, there are individual cases where it may very well happen. You got healthcare nightmares in the United States. People who can afford insurance and afford you know, the expensive drugs and expensive surgical procedures. We have doctors and nurses who are incompetent here too. They are the exception, just as they're the exception in those other countries. Because anybody who goes into the medical profession are there to save lives. They're there to improve people's lives. It's not a sexy headline to talk about the average Joe or Jane in England or in France or in Canada or in Australia or New Zealand or we're going to say Jose and Maria down in Costa Rica, where such a system exists. I'm being I'm be multicultural here. It's not sexy to say that all these people get up in the morning, go to work, play by the rules, pay their taxes, and live life. And when they get a little bit sick, they go to the doctor. The doctor treats these patients, gives them the prescription where it costs next to nothing or nothing in a lot of cases. They get well, life goes on. Or if they have a heart attack or a stroke or cancer or something like that, and they seek treatment or get a procedure done or what have you, it gets done. They recuperate in a lot of cases and go on with their lives. That's not a sexy headline. The sexy headline in the right wing press in this country is, and when I say right wing press, I include CNN and MSNBC because they're not much better than Fox. Um, Fox News, excuse me, CNN and MSNBC are basically Fox News people that are okay with gay marriage. That's basically it, you know. But they all are beholden to corporate special interests, which includes the insurance companies. And suffice to say that the Overton window is a little more sensible in the UK, and that's why you have Tories who are okay with the National Health Service. You hear that, Amy Klobuchar? You hear that, Pete Buttigieg? You hear that, Cory Booker? Joe Biden? You hear that? Hillary? Obama? You hear that? How sad is it that UK Tories are more sensible on healthcare than supposed American progressives? And this and people are getting open to the idea of single payer now, Medicare for all. At one time, and I remember when I was in the college Democrats and when I was at East Carolina, and the subject of healthcare reform came along, and they weren't for single payer healthcare. They wanted to hit the Hillary Clinton healthcare plan. And I knew that liberalism right there and then was in deep doo doo. And but now, thanks to Bernie Sanders running, he's made single payer Medicare an issue for people. He forced a national conversation to the American people that the Republicans and even many Democrats do not want to have as a conversation, which means it's a conversation where if Republicans and corporate Democrats don't want to talk about it, that's all the more reason to talk about it. But to make a long story short, and to not be so long winded this morning, Boris Johnson, Britain's Donald Trump, praised the NHS. Let that sink in. Feel free to respond, good, bad, or indifferent. I've been having technical difficulties on this computer, so bear with me if it somehow doesn't sound. If the sound quality is questionable. So if the sound quality is crappy, I apologize.